Emma Caldwell.
BBC Radio Nottingham.
Now it's time to jump straight in with our first guests, and a fact that I just genuinely didn't know. You might be surprised to hear this as well. Lung cancer kills more women in the UK than both breast and ovarian cancers combined. I'll say that again because I feel like it's shocking. Lung cancer kills more women in the UK than both breast and ovarian cancers combined. You don't have to be a smoker to be diagnosed with the disease either. And that is something both of my next guests know only too well. Emma Gould is a nurse who runs a clinic for women's health and wellbeing in West Bridgford with her colleague Ros Jones. And both of them have lost close family members to lung cancer and want to raise awareness about the importance of having the symptoms detected early on. Ladies, thank you so much for joining us this morning. We appreciate it. Ros, I'm going to start with you because you lost your daughter Rhiannon, a non-smoker who died in her 30s. What can you tell us about Rhiannon?
Yes, she was my beautiful firstborn. She was my best friend. She was an amazing mum to her two boys, Seb and Ollie, and she went the extra mile for everybody.
And when did she discover that she had lung cancer? Because as I say, I'm reiterating this because I think you hear lung cancer and you think, well, she must have been a smoker.
Exactly, yes. So this is really why Emma and I want to highlight that we're both nurses and we've worked with lung cancer patients, and it was always the mature man. Unfortunately, he smoked, so he got lung cancer. But this just wasn't the case for Rhiannon. So going back to June 22, she had a slight cough, went to her GP, who said she'd got mild asthma. I didn't think much of it because we all have hay fever and mild asthma within the family. He prescribed an inhaler. She still had this in July. She went back again and he just changed the inhaler. She came down to Devon, where I live, with her two boys. She has the summer off as she works in a special needs school as head of department. And there was nothing we didn't do. So she'd swim, boat, kayak. She was full of energy. So there was nothing that really alarmed me then. She did have a slight cough, admittedly. It carried on, but really nothing different to myself. And it wasn't until the end of August that things started to change. And she called me and she said, I don't feel well. And that's when I insisted she went back to her GP and she had a chest x-ray and pneumonia was diagnosed then. So it's a very short time. And she was then admitted to hospital. The fluid was drained from her lungs. She was in there for 10 days. I, in fact, saw the doctor who reassured me and said, we don't quite know what's wrong, but it's definitely not cancer.
Gosh.
4 days later, she gets a call from a junior doctor to say that she had stage 4 adenocarcinoma, which had metastasised. She wouldn't have known really what that meant. So an appointment was made for her to see a consultant that week, which I was there at the appointment. Rhiannon asked how long had she got, thinking, we've got a few years, we can make some memories, etc. And he said to her, tops a year. And she died within 7 weeks.
Oh, Ros, I'm so sorry. Emma, let's go to you. You are a nurse, the same as Ros. And there was no symptoms with Rhiannon, I beg your pardon.
No, only this mild cough. Yeah.
Well, this is it, just the mild cough. What symptoms should we be looking out for?
Well, I'm going to give you, obviously we work closely with the Roy Castle Lung Cancer Foundation, and basically they say anything, they've been trying to roll out this lung cancer screening for over 25 years, which they're slowly doing, but what we don't want is for people to panic if they've got a slight cough or a tickle or anything that's not quite right, even if they're a smoker or not, and to take advice from them. So it's okay to be worried but it's also okay to be sensible. So first port of call is to make contact with the GP. If you've had particular symptoms, so a persistent cough, wheezing for 3 weeks or more, whether you're a smoker or not, whether you've had a fever or not, you can go to private clinics. You can contact the Roy Castle Lung Cancer Foundation, and they will signpost you. In the East Midlands, we don't actually have the screening programme yet. They're only about a third capacity with Roy Castle, and at the moment you can get screening, lung cancer screening, if you're previously history of smoking and you're between 55 and 74. Now
Which, of course, is not Rhiannon.
Isn't Rhiannon, and it isn't my stepdad. And usually they will just do some basic lung checks, and if they feel that you need to go further, then do. But yeah, don't ignore any symptoms, or get in touch with Roy Castle if you've got any concerns, and they will be able to direct you.
And I think that stat that was just said at the beginning, lung cancer kills more women in the UK than both breast cancer and ovarian cancers combined. I just didn't realise that lung cancer was one of the biggest killers. I just don't think that's something people know.
No, and we didn't. I mean, to be fair, Ros and I have got more than 20 years' experience in nursing and women's health. That's why we've set up our clinic to help people to stay well. But it's shocked both of us, and we felt, and this, the 1st of August being such a poignant date is why we're here today.
So the 1st of August is not only World Lung Cancer Day, am I right in thinking it's also Rhiannon's birthday as well? So we're going to be talking in just a minute about what you're going to be doing for World Lung Cancer Day. But stick there just for a second. Got a song to play. We're going to be talking to Emma and to Ros, nurses who run a clinic for women's health and wellbeing in West Bridgford here in Nottingham. Both of them, as you've heard, have lost close family members to lung cancer. They want to raise awareness about the importance of having the symptoms detected early. We're also going to be talking more about that. Good morning. It's 22 minutes past 10. Emma looking after things for Dino today for you. And we're joined by two incredible guests. Emma Gould is in the studio with us. She's a nurse who runs a clinic for women's health and wellbeing in West Bridgford with her colleague Ros Jones, who joins us on the phone from Devon this morning. Now, both of them have lost close family members to lung cancer. Ros sadly lost her daughter, Rhiannon, who died in her 30s. Of lung cancer, and Emma lost her stepdad last August, again to non-smokers lung cancer too, after 18 months of him suffering immensely. And it's so hard to see someone you love suffering, isn't it, Emma?
Oh, especially someone as tough as him. I mean, he was 76, but he was still fitting carpets this time 2 years ago.
Blimey. And I think, the importance of you two coming in to talk about this is you cannot deny how important it is. Let's talk about the symptoms. Why is it so important that symptoms are detected early? And I think some of them are so hard to see as well.
Well, yeah, I mean, Rhiannon and Dave didn't tick all the boxes, which is why they didn't get investigated as quickly as we would have liked. And we'll never know. But, things like rapid weight loss, wheezing, coughing, different coloured sputum. I mean, especially in cough and cold season. But if it's persisting, if you're really not feeling well, and if you've got a family history, not many people have got a family history, but maybe.
Yeah.
Also, if you've had a history of smoking, but also if not. So any symptoms that you're not sure about, or if you think, should I bother the GP, then like I say, Roy Castle have got nurses on their helpline as well. To advise you where to go. And like I say, the lung cancer screening programme, we haven't got it in the East Midlands yet. It's coming, but these guys will be able to direct you rather than you panicking, ringing the GP, worried well or not.
And I think that's the thing. And you made it very clear when you came in, you're not here to panic people. Yeah. But if, your stories, yours and Ros's stories can make a difference, then that's a good legacy for the people that you love. Now, I know on Friday, it's a really special day, isn't it, Ros?
It certainly is, yes. It would have been Rhiannon's birthday, and ironically, it's World Lung Cancer Day. So this is why we're really, working towards making awareness and opening our clinic that day.
So what are you going to be doing on Friday?
So we're going to be on Central Avenue on the croquet lawn at
in West Bridgford.
In West Bridgford, yeah. So our clinic's a little bit further down the road on Tudor Square. So we've got a raffle. We've got so much kindness in the whole.
I mean, I was just going through the raffle prizes.
Wow.
They are good.
Well, everybody's a sucker for a sad story, I suppose. But yeah, we've been so grateful. We've done raffles and stuff before on the 1st of August, but the generosity, and these people, our business neighbours as well. At 11:15, we're going to have a little ribbon cutting ceremony for the Rosem Clinic with the Rushcliffe MP. And then basically we've got Notts Health Partnership also going to be offering some free health checks and advice. So again, if you're worried about any symptoms or suffering with things like grief and whatever, we can signpost and come and chat to us, listen to our story. My mum's going to be there, my daughter's going to be there, and she was as close as anything to her granddad. And Ros is going to be there. She's coming up from Devon tomorrow. So we, Rosem. Didn't take as long to come up with that.
I mean, it's a great name for a business.
Yeah.
And I think the thing is as well, unfortunately, this does happen to people, and you won't be the only people that have gone through this. And there will be people we know that are listening to this who are going through this at the moment. And I think sometimes just even having that outlet of someone to talk to, Emma, when you came into the studio, we had a great big cuddle. Like sometimes you just need that extra person. So what time are you going to be on the croquet lawn?
From 10 till 4. I mean, like you say, with the figures, we're nurses, women's health, and we didn't know this. So
why do you think we don't know this? Why don't we know this? I mean, I say we, like you say, you're nurses.
I don't know, and it isn't easy being on the other side of it. It does us all good to be a patient or a relative every now and then, but yeah, I think Rosamond's reason for doing all of this is to make sure nobody else goes through this, or at least go some way to preventing that, so that 2 little boys don't miss their mum. That's hard. Those little boys are growing up so quickly. And again, just ask.
And I think sometimes as well, we were talking about this when the song was playing. I think sometimes when you've gone through such a massive loss, doing something about that and raising awareness and keep talking about Dave and Rhiannon, it makes a difference, doesn't it, Ros?
Oh, definitely, yes. I mean, I can't bring her back, but I can surround her boys by laughter, because she certainly often had the last laugh on me. So, yes, I can, tell the stories to the boys and really giving them a little bit of stability and life experiences that Rhiannon would have done. So that's, what I feel I must do now.
And you're doing it very well as well. And I know that it's difficult to come on the radio and talk about something like this, about something that is so close to you. But I genuinely think you will be making a difference to people. So Emma and Ros, thank you so much for joining us today. We appreciate it.
Thank you.